Hi, I'm Patricia King, and I'm here today to explain to you why a CRM information technology system should be implemented at Blue Shield of California. Healthcare organizations throughout the world save and store data. Unfortunately, the way they save and store it varies. Some of them still create manual entries, utilize several databases that are not interoperable, which can double or triple the amount of time spent on data entry. This increases the rate of medical errors, which endanger patients, delay patient access, decrease patient satisfaction, increase employee costs, and decrease employee morale. The Medicaid engagement team at Blue Shield of California must develop a customer relationship management system. This will ensure that stakeholder data throughout the company is not only standardized, but accessible, unduplicated, and interoperable. Blue Shield of California works throughout the state of California and was founded in 1939 as a nonprofit. They currently support almost 5 million members statewide. The Medicaid engagement team communicates daily with hundreds of community stakeholders, officials, and community business organizations. Employees with this team currently have outdated, isolated Microsoft Excel documents where they store and save stakeholder data. This causes duplicates and lacks interoperability. Non-standardized data alone causes barriers while jeopardizing relationships and procurement. The Medicaid engagement team is comprised of 45 employees statewide. It is very important that they are able to communicate, share these data findings and stakeholder relationships with one another to move the relationships and enhance the work of Blue Shield of California. A risk analysis strategy must be completed to keep Blue Shield of California safe, employees safe, and stakeholders safe. The security officer at Blue Shield of California should conduct an assessment of where all information is housed. Currently, it's in several different locations. They should also examine the potential risks and exposures in alignment with HIPAA regulations and guidelines. Last, they should distinguish threats and their severability. How and what ways can people have access that are unauthorized? By creating a third-party vendor contract, otherwise known as a business associate agreement, according to HIPAA regulations, can help keep not only the CRM organization vendor safe, but also Blue Shield of California. Additionally, Blue Shield of California should identify user-based access levels for different employees. All employees are not granted access to every single level of stakeholder information. That can be deemed appropriate by supervisors, IT, and the security officer. There are many important factors in the decision-making process before selecting a CRM at Blue Shield of California. The system development lifecycle is a great process that can be utilized to really understand what is happening and where the organization needs to go. Before beginning, a root cause should be identified to see if something actually needs to be implemented. Given the fact that a root cause has been identified, the system development lifecycle can begin at phase 1. At any time during the CRM implementation, if there is a problem, or in several years down the road, we can always go back to phase 1. It has been identified there's a huge problem. Non-standardized data sets and manual data entries on static forms pose significant risks and jeopardize communication, which leads to failures. And if a failed communication with a stakeholder happens, it can jeopardize relationships and procurement efforts from Blue Shield of California operating in Medi-Cal counties. Therefore, in phase 1, technology, operations, and financial viability must be assessed. Blue Shield of California does have available technology, staff, and teammates to support bandwidth, Wi-Fi, and security measures. Operations and financial viability is also available. Therefore, we can move on to phase 2 of the system development life cycle. In phase 2 of the life cycle, the different options of CRMs can be considered. A cost-benefit analysis will be done, and all of the different information systems will be evaluated according to different measurables. A contract will be created and assessment of risk will be looked at for each of them. The 2 front-running available CRMs are Salesforce.com and Monday.com. They are also being used in alternative departments throughout Blue Shield of California. The third phase of the system development lifecycle is the implementation phase, which will require significant allocation of resources, such as conducting a workflow and process analysis, installing the system, testing the system, training staff members, converting data, and preparing everyone for the go live. Appropriate resources, buy-in, and troubleshooting capacity must be available in this phase. The last phase in the system development lifecycle is support and evaluation, which would include monitoring the system, keeping upgrades up to date, supporting employees, and creating ongoing trainings and audits to ensure that the application is being successful. How to manage change and mitigate setbacks. There are a lot of different variables that can pose problems which would create an unsuccessful implementation of a CRM. CRMs can fail due to a lack of user adoption, poor planning, a lack of training, selecting the wrong system, not having measurable objectives, a lack of executive leadership buy-in, failing to involve users, having bad data, having too many software features, or other variables. Some of the solutions to mitigate change and setbacks are to create a multidisciplinary project team to champion the project. In this multidisciplinary project team, it is very critical to include the project scope, the exact goals, roles of everyone involved, and have a detailed plan that includes accountability measures along the way. Not having this project plan in place is one of the #1 reasons why system integrations and adoptions fail. Second, to support mitigating setbacks, standardized data fields must be created before implementing the CRM. All of the different users and employees that are currently collecting data must agree on standardized data fields and begin consolidating their current data. Lastly, one of the points that really supports managing change is creating a culture of knowledge sharing, incentives, and employee trainings for support. Culture of knowledge sharing needs to start in the very beginning. By having this, employees will have buy-in. By utilizing incentives, they can get excited. And by ensuring that they have employee trainings, they will always feel supported, not only in the beginning of the CRM adoption, but throughout the process and after it's over as the system needs upgrades and modifies through time. There are many appropriate key individuals that are needed for the successful implementation of a CRM and its strategy to be completed. The 3 key teams are information system supporters, a project team, and governance committee. Before selecting any of these teams, it is very important that everyone clearly understands their roles. The main roles to support strategy include the information system supporters. In this case, the CRM at Blue Shield, California would be utilizing a Chief Information Officer, a Chief Technology Officer, and a Chief Information Security Officer. The work that the Chief Information Officer would do would be including setting the vision strategy in alignment with Blue Shield of California objectives. They would be responsible for process changes to capitalize on this investment and assess the value of the CRM while interacting with internal and external partners and communicating all of the performances of the CRM to the project team, governance committee, and employees alike. Technology officer is responsible for defining what the CRM technology standards are, ensuring that technical infrastructure is current, updated, and available, ensuring that the desired CRM of Monday.com technologies fit with current systems in place, and assess other competitive CRM systems such as Salesforce.com. Chief Information Security Officer will support the project team by ensuring that it's compliant with federal and state security regulations, most importantly aligning with Medicaid requirements, providing operational information security plans, and putting technical and administrative processes in place. This will help support in creating an appropriate threat and recovery system for procedures in alignment with HIPAA regulations, certifications, licensures, and accreditations. Improving decision-making and patient care with health information governance is very important. Data analytics can be applied to healthcare information, and research studies based on healthcare information is just a great example of how transforming healthcare information into new patient knowledge can support outcomes and future objectives in healthcare. Initially, data must be standardized in the CRM so that every single stakeholder has the exact same information on file, and each file entry can be compared to each other. That way, Blue Shield employees can go in to evaluate the different data sets to be able to compare them in analysis with current trends and things that are happening. The data, once input standardized into the CRM, then will be analyzed and converted into information depending on who the audience is that's viewing the information. Once the information is extracted, knowledge can be used to create decisions. This decision-making process from the data can improve systems and health outcomes, all with the support of health information governance. This knowledge will then be shared to create different structures, policies, and relevant procedures that different hospitals, healthcare providers, and medical insurance organizations such as Blue Shield California can use to create better, equitable, affordable program and policies for patients throughout California. There is a balancing act of enterprise-wide data and information governance. It is very important that the enterprise-wide data has stringent policies, rules, and structures around them to ensure the safety for Blue Shield of California as well as patients and stakeholders alike. CRM data must be secured on an enterprise-wide scale. The CRM must comply with HIPAA standards, rules, and regulations. The CRM also must comply with Medicaid requirements. An IT steering committee can support data governance, information exchange, technical and structural interoperability by being able to have an unbiased role and expertise and supporting by looking at different layers of the CRM project. The fiscal impact of utilizing Monday.com as the CRM for Blue Shield includes a total of $8,640 annually, in addition to any a la carte features employees may need to be added later. An additional cost-benefit analysis can be done to compare this along with other CRM applications such as Salesforce.com. Potential questions to ask the board are, what are negative and positive consequences of not implementing a CRM? Why should Monday.com be selected? And how will you measure the value of this CRM to establish success and long-term sustainability? Answers can be found in the notes of this PowerPoint deck. In conclusion, it is paramount that stakeholders have a great relationship with Blue Shield of California as they support healthcare policies, funding, endorsements, development of research, and healthcare resources. Implementing a CRM such as Monday.com will not only standardize data, improve internal communications, improve decision-making, but also embrace partner relationships and amplify procurement strategies for Blue Shield of California.